and all members are apparently healthy. So the disease progressed to complete paralysis below the neck, and he lost his ability to stand, sit, or walk, and he has been bedridden for the past 15 years. And he relied on lifelong flowing catheter since December 2009. Now, I would like to call upon Dr. Helix to take over the presentation. Thank you.
Thank you, sir. Good morning, respected chairpersons, judges, and everyone present here. I would like to continue with the rest of the presentation. Coming to examination performed to assess the current clinical status of the patient, we have in the motor examination, coming to his upper limbs, there was no movement left in the left upper limb, and right upper limb there was slight flexion and extension, and he can hold objects, and this is the only functional movement he has left in his upper limb. And in the lower limb, bilateral lower limb, no movement was present, and you could see muscle atrophy. Coming to the sensory examination, all the sensations are intact in the upper limbs. In the lower limbs, only crude touch sensations were intact, and fine touch, ability to localize pressure, pain, temperature, proprioception was all lost below the waist. And for bladder and bowel, this thing depends on polycatheterization since 2009, and he can pass stool only with manual evacuation, which his wife assists using gloves. And so patient was diagnosed by cervical transverse myelitis with type 2 diabetes mellitus and hypertension on 5th of December 2009. And coming to his long-term care, bowel and bladder management were all done by bowel evacuation by manual bowel evacuation by his wife. And for skin integrity and pressure sore prevention, he uses air mattress and strict repositioning schedule. Despite having paralysis, complete paralysis below the neck, the patient is emotionally stable due to constant family support and support by the Palliative Care Society Imphal also. He extends his special thanks to Palliative Care Society Imphal, and the family ensures he lives with dignity and unwavering care, preventing social isolation. Key takeaways from this case: cervical myelitis can cause lifelong irreversible disability. Early aggressive therapy like plasmexing therapy or maybe immunoglobulins maintains outcomes. Chronic paralysis requires multidisciplinary care, and family and palliative care dramatically improves quality of life. This is the patient along with his wife, and you can see that even though his face is masked, I mean, he was smiling, and his wife also was smiling, and like there was too much love between them also. And this is the team, the visit team from the LIMS side. So we took photos with the patient and the patient party, and this is us. Okay. Here I would like to end my part. Thank you so much, everyone.
Stay on. Now I request the judges to ask questions to the competitors.
Thank you. It was a very good presentation. So, what do you mean by dignity? Why dignity is very, very important in palliative?
Dignity.
Before you mentioned about dignity there.
Dignity means how a person perceives himself in the social setting, and how others also perceive him, and that's dignity according to me. Might be not as accurate because it was asked on the spot.
What do you mean by total suffering? Can you elaborate on what is total suffering?
Total suffering. I think it's related to what a person suffers in the aspects of physical pain and emotional emotional and all the aspects, total combining all those pains.
Anyone else wants to add up?
It also refers the psychological aspect also. When we visited in the place of the patient, we can observe there is hanging photos in the wall. He was a cricket player, I guess, but now last 10 years he could not move or he could not do any work. He just observed his photos. There was just one radio in his bed. So the empathy which is taught by our teachers of in phase 1, we can feel that one in that day. He is observing his old days, so it is very suffering for us also. It is very painful to see him, his old days and comparing with the now situation.
Okay, thank you.
It was a very good presentation. As a student, I want to know that what you can do to this patient.
We can provide mental strength, we can show empathy towards the patient, and the lifelong journey we can stand by themselves as a medical professionals and the society members also. We can even just simple things also, we can just stand by them, just sit by them, and we can talk also. We can provide all the things so that he can live the entire life with some, he can expect that we are also with himself, and he may feel very good by presence of ourselves. He was very happy when he visited there, seeing many people around him. It was a very nice experience for him also. He said many times thank you, keep visiting our home. It was really encouraging for him also.
So, what is the difference between sympathy and empathy?
Sympathy basically
Give
refers
some examples.
No, I request the audience to abstain from asking questions. This only the judges can ask questions. This is a competitive session.
Sir, I must answer.
Only the judges.
I must answer, sir.
Oh, I'm sorry. I thought only.
I'm not a gentleman.
Okay, sorry. Please.
So, can you give good example? Sympathy and empathy.
Sympathy basically means feeling sorry for a person, and empathy means feeling that pain also, just like cancer. If a certain patient has cancer, I can say, oh, I'm very sorry you have cancer. But if a cancerous patient is there in my family, I can also feel that pain. So this is empathy, to feeling the pain of the patient by my own self.
Empathy means as if you are suffering.
Yes, as if I am suffering.
So, can you just highlight us about the catheter gear? Urinary catheter gear. It's very important.
Sir, catheter, he changes his catheter every 2 weeks. Sir. Previously, it was changed every month, but due to like blockages and certain infections, like he had UTI, some episodes of UTI, so I think he has been advised to change it every 14 days.
Thank you.
Yeah, thank you so much, sir. Thank you, everyone.
Now I request the next set of participants from CJ Academy of Health Sciences, represented by Aishwarya, Sneha, Makbul and Suraj.